Good afternoon. Welcome to this edition of Advocacy Insight, NEHA's look into the latest concerns surrounding the environmental health profession. Today we have with us Tim Leshan and also Beeta Rasouli from the Association of Schools and Programs of Public Health to discuss recent efforts by the U.S. Department of Education to redefine what constitutes a professional degree. Tim, good to see you. Could you introduce yourself and introduce your association?
Thanks, Doug. Really appreciate you having us here. I'm with the Association of Schools and Programs of Public Health. I'm the Chief External Relations and Advocacy Officer. We represent 155 schools and programs, mostly in the U.S., across the whole U.S., but we also have international members as well.
And that sounds great. Thank you very much. Beeta, good to see you with us, have you with us this morning. Could you tell us a little bit about yourself and what you do at the association?
Yes. Hi, Doug. Thanks for having us today. I'm Beeta Rasouli. I'm the Director of Advocacy at ASPPH. I work closely with Tim Leshan on our policy and advocacy portfolio, representing our members as well as the public health community. I have a background in public health. I have my MPH, so I'm very passionate about anything and everything that touches the public health field. So thanks for having us today.
Well, thank you. Thanks for joining us. Hey, guys, could you tell me what's the landscape? What does it look like out there for the public health academic community?
So, Doug, there's good parts and bad parts, right? On the one hand, there's a lot of interest in public health and environmental public health by students. And, we represent the schools and programs, the accredited schools and programs that are working on research, education, and practice in public health. And so I think there's a lot of enthusiasm for the field. At the same time, after COVID, there has been a big pushback against public health in general. And so some students have been concerned about getting their master's in public health. Not that the numbers of students have gone down that are getting their degree, but we are seeing some students being a little bit skittish about whether or not they should go, what their career path is going to be, those kinds of things. But our schools and programs have pivoted in order to make sure that they are training the next generation of experts in public health, whether they go into governmental public health, academic public health, or even into into industry or nonprofits. So the landscape is a bit daunting at the moment, but we are optimistic about the future, and we think, there's always ups and downs in a field. And I think right now we're struggling. Some of our places are struggling a little bit just because of the broader environment that's been very anti-public health. But I do know that our schools and programs are still training the next generation and still making an impact in their communities. Beeta, did you want to add anything to that?
Yeah, sure. I think public health as a whole has, there's been a challenge. It's become very politicized ever since COVID-19. And so speaking from the policy and advocacy side of it, I think this last year has brought a lot of challenges, some which have been anticipated, and I think some were unexpected. And so being able to navigate the many changes that have impacted public health funding and policy, I think that's an area that we've been focusing on a lot lately over the past year, but also looking for opportunities. Where are there areas where we can find some sort of bipartisanship? Public health is a very general a phrase, right? There's so many aspects within public health. So where are the areas where we can find some sort of consensus and agreement where everyone will be on board? So looking to be more proactive in the field.
Yeah, and you bring up a really good point here. which is COVID through, changed the entire paradigm of the public health community. How have the schools changed to address this new viewing landscape of public health?
Well, I think they've thought about, their curriculum and updating their curriculum. We at ASPPH came out with a report called Framing the Future last year, and that's really looking at where's the field going to help our members be prepared to train the students for the challenges that are coming in the future, right? But I also see a lot of our members really re-looking at their engagement with their local communities in a very effective way, and realizing that, in some cases, academia has come in and sort of been, we want to research, your community. And now it's much more about doing research or programs with the community. A great example is University of Memphis, which has started public health clubs in the high school in Memphis. And I think it's going to get expanded across the state of Tennessee, and I hope it gets expanded across the country. And this is a way to really engage young people in the field of public health and have them understand the importance of public health at a younger age, which, might translate into more people going to schools of public health, but more importantly, have the broader public better understand the field. And so we can start to turn the tide on the negative messaging around public health.
Go ahead, Betta.
If I can add,
Yeah.
I think in addition to Tim's point, I think we've seen a lot more engagement on the advocacy side and having our members play a role in bringing awareness to their congressional delegations. We host an annual Hill Day where we have members fly in and meet with their members of Congress to discuss the importance of academic public health and why certain funding and policy needs are necessary to be fulfilled by Congress. And I have seen over the years, there has been more of an appetite for some sort of involvement in the advocacy and policy side as well. And I think COVID-19 had something to do with that. And it's necessary because, unfortunately, I think when you speak to certain congressional offices, they don't have the technical awareness of what public health even is. And so to have our members be able to provide that sort of information to policymakers, I think has been very pivotal for our community.
You mentioned that not every member of Congress really understands public health, let alone the academic side. What's the distribution of schools of public health? Not every state has a school, do they?
No, not every state has a school of public health, but I think every state at least has a program in public health. And what I mean by that is there are freestanding schools, like the Harvard Chan School of Public Health, or the Johns Hopkins Bloomberg School of Public Health, right? But then there are also smaller programs within, let's say, a college of science or health sciences. And so every state has a program to train people in the field of public health. So we're very fortunate as an organization that we can touch, members of Congress and folks across the country.
Yeah, and it's gonna, that's good to know, because when you deal with policymakers, not only do you deal with Congress, you got the states. And some states are very well aware and very effective at supporting their educational community, and some are not. Have you done any work with the states in enlightening them on their public health programs?
Well, as an organization, we don't get involved in state policy because we're a small nonprofit that focuses on the federal side. But that being said, all of our members just about work with their state governments on issues of public health. And lately, there's been a lot of bills at the state level that have been very much pushing back on public health initiatives. And so our members are interacting quite a bit with their state legislatures. And we provided them some tools in terms of best practices in terms of interacting not only with their congressional folks, but also at the state and local level. So we enable our schools and programs to do that, but we're not, let's say, in Florida lobbying the Florida legislature.
Gotcha. But it's good. You got tools out there to help enlighten folks, and you're working directly with Congress on how these programs are very vital to the public health community. We talk a lot today about public health, but there's a big component of public health, which is where we focus environmental health. Could you talk to us about some of the efforts that are going on in the schools of public health to make sure that environmental health is addressed?
Yeah, absolutely. And I think it's been, over the last decade or more, been a very hot topic at a lot of our schools. So a couple of years ago, we created a report that was developed by our members about climate change and health. And we brought in the experts, and they came up with recommendations back to our schools and programs about how they can make sure that they're working on those issues effectively, both in their research or as well as their research and their classrooms, and even working with their communities, right? So, and then also provided some recommendations on public policy. So we really tried to give people a framework to work with to make sure that they're covering environmental issues effectively in their schools and programs. And then, obviously these issues around environmental health come up at the state and federal level. So we've been engaged on some of that. I don't know, Beeta, if you want to add anything to that.
No, that's I think a good summary. And we've been working with our members to identify areas in the federal space where we can influence some sort of support, policy support or funding support for environmental health issues and climate and health issues, mostly within the NIH. If there, are opportunities within NIHS and other spaces, that's something that we've been doing our best to collaborate with the task force on. Although, again, it's been a little bit more challenging this year as far as influencing policies in that space.
Yeah, the reason I had to laugh is when you talked about NIH, I thought you were going to say, that if they eliminate it. And fortunately, the budget came through, and I think we're going to be able to see NIH survive in some capacity. Did Beeta, did the Congress, did you ever hear anybody in Congress talk about, well, you're talking about public health, did they say, hey, this is climate change, or this is food and water, or these are things we have thoughts about?
I think specifically within ASPPH's wheelhouse, we've been, again, going back to my point of looking for areas for bipartisanship. We've been looking for opportunities with certain members of Congress who have introduced bills. For example, there's a Plastic Health Research Act, which was introduced earlier last year, I believe. And that was a bill that we endorsed. And what that would essentially do is create centers of excellence within NIH to do more research on the impact of microplastics on the environment and health as a whole. And so we have been looking for those opportunities, and there have been certain members of Congress that have reached out to us, knowing that we have this climate and health initiative, to see if we can collaborate with them. And of course, we're open to those opportunities, especially if there's bipartisan support. So that's one example. And of course, I think a few years ago, it was a little different story than it is this year. But the fact that we are still getting that sort of traction in the environmental health space is a good sign.
That's great to hear. But what is not so great to hear is some proposed regulations that are coming out of the Department of Education. Sounds like they're wanting to either exclude the master's or the doctorate of public health degree from their list of professions. Do you want to expand on that?
Yeah, I'll kick it off, and Vito will definitely fill in more details. But so Congress passed the One Big Beautiful Bill, which had some, for us, some troubling provisions. One was getting rid of the Grad Plus loans, and the other was um, trying to define what is a professional degree. And so, but they left it fairly open, right? They said these are the degrees that are definitely professionals, but it left it to the discretion of the department to figure out exactly how they were going to define it. So the Department of Education has had a negotiated rulemaking process where they have
Okay.
developed a proposal around only having 11 degrees, such as medical degrees and law degrees, that are considered quote unquote professional. This is a whole new ball of wax, and we, public health and nursing and many, many other degrees are not included in the professional degree. And so what does that mean? It means that there are lower loan limits, lifetime limits of $100,000 if you're not a professional degree, and a yearly limit of $20,500 for your loans for a school or program of public health. And that, we are worried, is going to impact the number of people applying, the number of people graduating, the number of people in the workforce for public health. Beeta, please give a little bit more detail here.
Yeah, absolutely. I think Tim mentioned that this is not unique to just public health. This is something that's going to be devastating for the entire health professions workforce, including nurses, physical therapists, occupational therapists, social workers. The list goes on and on. And so we have been working closely with a coalition of these various professions to first respond to the Department of Education. Unfortunately, monitoring the negotiated rulemaking process and seeing the preliminary proposal that the RISE committee did put forward was not in favor of public health and the other health professions that I mentioned. So we have also been simultaneously working with Congress, and I think it's been great to see that there have been 5 bills introduced in Congress to expand this definition, many of which would include public health or reverse the policy in a way that wouldn't impact public health in such a negative manner. So we're doing our best to advocate for this topic. Again, seeing the amount of engagement by our members, and I know this is true for the others, professional associations, how much interest there has been in spreading the word about the ripple effect this is going to have, not just on the pipeline, but continuing on to the actual workforce, and how this is going to be a big problem, in particular for local and state health departments that are experiencing shortages. And this goes back to COVID-19 and lessons learned. Have we not learned our lessons about not having the right public health infrastructure and workforce in place in times when they're needed the most?
Yeah, I think you're really kind of highlighting some very important things here about, you know, are we effective? Are we prepared? Or how are we really doing our public health workforce a service by the directions we're going here? And it makes me feel good that there are several members of Congress that are not supportive of this direction. And that's going to lead, just to clarify, the big, beautiful bill, which authorized this activity, did not specifically say, let's get rid of public health. It just gave discretionary authority to the Department of Education. Is that correct?
Yeah, I mean, they've never limited the number of they've always left it to institutions to decide what's a professional degree at their institution. So this is a whole new way of thinking, of having the federal government top down decide what's a professional degree and what isn't. And so what's going to happen is in the next few weeks, we believe that the final rule will be published by the Department of Education, and there will be a 30-day comment period where we and many others will be weighing in to push back on what we believe will be a regulation that will leave out public health, both the master's and the PhD in public health, which is quite troubling to us and our members. So we will be weighing in on that process and hoping to have them see a better way forward and include public health. But just to be clear, Doug, we're not optimistic that it's going to change in our favor. So we'll have to see how that plays out. But we are quite concerned at this point.
Peter, you talked about this a little bit, but do you want to expand on the impact this rule is going to have on the state and local public health agencies?
Yeah, I think, looking at the pipeline part of it, where we've seen a fluctuation in the number of students or prospective students going into the public health field, and that's essentially going to be your workforce after a few years, and making sure that the workforce is well prepared through training, practicums, the hands-on experience that they get through their MPH and DRPH programs. DRPHs are particularly important for leadership skills. And again, we know during a pandemic, that's extremely important, particularly on the local and state level. You need to have the right leaders in space, making the right decisions. And so I think it's more so looking forward, if you're going to put limitations on the amount of loan support that potential public health students can get, that's going to deter them from going into this field in the first place in a time when it's needed the most. And then connecting the dots, if you don't have enough people going into public health with the right skills necessary, especially those that are important for local and state health departments, if you're already seeing a shortage in these areas, you're just going to make that problem worse. You're not going to have a well-equipped, well-prepared, trained workforce in governmental public health. And so that's the point that I think we've been trying to drive. Unfortunately, there's some dots that need to be connected there. And I think this goes back to the general public not being very aware of what public health is and the role of public health professionals, specifically in state and local health departments.
Yeah, and I think you made some really good points here. The first is that we're seeing a dramatic drop, a dramatic set of retirements going in. People are leaving the profession. We're short already. I think I've seen numbers around 50,000 out there, and I think that number came from NACCHO saying we're short, and we're getting short. More and more positions are not getting filled, and there's been several discussions out there that we've had, that other associations have had, about how do we build up the profession, how do we get the folks back. But the big point is when you get the retirees, when you get that level, people who've been involved in the profession for 20 and 30 years, we've lost the leadership. We've lost the people who have experienced these things before and can make wiser decisions than the people who are thrown in, who have no background. And even though you mentioned COVID, stuff happens every day in public health that a local public health director has to deal with, that there's no background on this. We've got a new outbreak. We have a new bug out there. We have a new vector problem. Nobody knew about West Nile. It hit. Nobody knew about, all these different, well, now we got screwworms coming up from, and of course that's an agriculture, but still, it was not a problem Now we have that. How do you, what are the efforts that can be done by the public health community, by the academic community to really build that leadership up and really reinvest in public health?
Yeah, there are probably a number of things, but one of the things that we really have been trying to emphasize with our members, and they've been, taking us up on this, is going into their local communities and actively listening to their communities about what their concerns are around public health, so that it's not so much academics going into the community and telling them, you've got to get vaccinated and all that. I mean, all that is true. They should, right? But really trying to change the way we dialogue with local communities, and at the state level and at the federal level, so that people understand that what we're trying to do in public health, um, similar to the Make America Healthy Again, even though I don't like the again part, we're just trying to make sure that people are healthy in the broader community, and realize that if you're sick, you can make someone else sick. Or if there's an environmental issue that impacts you, it can impact the whole community. And we need to make sure that we're thinking in that sort of broader public health way, not just thinking about how need to go to the doctor for our own health, but thinking about how our health impacts our neighbor's health and our community's health. So we're seeing more and more of that perspective from our schools and programs. And I think it's going to take some time to take back that narrative, but I think we are making some headway, and we're providing all sorts of tools to help people do that.
Yeah, and one of the things I'm kind of curious about, do you have any thoughts about how the students can protect themselves? This is a question really for Tim. It sounds like you think this regulation is going to go into effect.
Yeah. And so we're very concerned that this will go into effect. And then what will happen is that students, especially those, Beeta and I benefited from student aid, when we were in school, those people who can't afford the full amount of the program or the school because they can only borrow so much. And what's that mean? It probably means, and then they're going to have to go to their local bank and borrow more money, which will be at a higher interest rate, which will mean that they will have more debt and have debt longer. And we already know that a lot of folks who go into public health, they don't go into public health to make a lot of money. They go in public health to make a difference and make an impact, right? So they're not paid as well as maybe some other professions. And so if they have more debt and they're not paid well, what does that mean? Are they going to be able to afford to be in the public health work sector? So as we were talking before, it's going to have a lot of ripple effects down the line. And there's also just the psychological impact of, oh my goodness, am I going to be able to afford this to go to school?
Yeah, and we're seeing you're right about the ripple effect, because we're seeing pressure coming in from our local agencies to say, well, can we, limit this standard, or do we be able to hire people without a credential or without background? And that's just simply because they can't afford to hire somebody who's, really has a good, solid, quality background in public health. And you do get a ripple effect, because the community sees, hey, this isn't a person who has a master's in public health. This is a person who came out of college or came out of high school even,
Yeah.
and they're going through with a checklist telling me, well, I should do this. They got no credibility.
Yeah. No, I mean, we need to be creative about the workforce, right? And we work on assisting the disease intervention specialists, for instance, who may not have a master's in public health, but we want to make sure that they understand public health and understand enough so that they can be educated well enough to do some of these jobs that don't require a master's in public health. But we are worried that fewer and fewer people are working in governmental public health because of the salaries, and because they are concerned about what will happen with their careers going forward.
Yeah, you really segue us into the final question I really want to bring us up to is like, what is the field of public health going to look like with this regulation in place in the next 3 years? the next 5 years, and for people who are going in as a career in the next 10 years? What do you think this is going to have? What kind of impact do you think it's going to have on public health?
Well, one thing I want to say, Doug, before we finish is that we all thought that, it was going to be a really bad year for public health. And in many ways, it has been a very, very challenging year. But if you think about it, you know, we at ASPPH, along with others, have pushed back on some really bad public health policy, and are pushing hard against this rule that's coming out. And you see that for instance, as you said in the beginning of the podcast, that the NIH budget and the CDC budget were not cut in dramatic fashion. In fact, the NIH was increased slightly. So I hope people are realizing that the work that we all do on behalf of the field is having an impact. And then going forward, as you asked about, we are concerned that fewer people are going to apply to schools of public health and fewer people are going to go to schools of public health. But we want to make sure people understand that if you get a degree in public health, you don't necessarily have to go directly into that field today. I think right now there's a crisis and it's going to be fewer positions and whatnot. But there's going to be a new administration at some point, and there's going to be renewed efforts to support public health going forward, because we have to do that if we're going to survive as a community. And so I'm hopeful that this is sort of just one of those slight bumps in the road, and we'll come right back up and people will be much more engaged in public health. And it gives us a chance to sort of reframe it a bit in a way that is positive for everybody. Peter, did you want to add to that?
Yeah, I think, Tim mentioned earlier that we're going to see, if this regulation does go into effect, of course, we're doing everything we can to prevent that from happening or to reverse it through congressional means. But if that doesn't happen, I think we'll see more students seeking out private loan support. And that's going to impact the pipeline, just because we'll probably see less students going into the field. And we already had the conversation of the impact that will have on the workforce as a whole. But I think the silver lining of this is this topic, I feel, has emboldened the public health field so much to be vocal about the importance of public health and why public health is a professional degree. We even have a campaign called Public Health is a Professional Degree. And it's not just about the loans, right? Of course, like that's a big part of it, and getting financial support to help pay your education for your education. But more so the label of how dare you not consider us to be a professional degree. We've always considered ourselves to be professionals. And so I think the community has really come together on this topic, which is needed, because sometimes we see division within the public health community. And so, if anything, I think this has empowered the public health community for us to tell our story and explain who we are and why we're important as public health professionals. So I see that as a win.
Well, that's great. I mean, that's a real positive. One of the things I kind of emphasize is that environmental health is not a luxury, because no community can survive without a water, a wastewater, or a food safety program. And we do see that out there with communities that try to back off on it. Well, you don't have as robust of a community. You got the business sector that pulls back, and we've had huge impacts when you see that a community does not have a solid public health, environmental health program. They're less able to attract people, to attract businesses, to make things happen. So, I think you're very correct here. It allows us to highlight our profession, and it allows us to say this is why we do this and why it's critical that you have people on the ground to check this stuff and make sure we don't have any sort of outbreaks, because COVID was a dramatic impact on our economy like nothing we have seen since the Depression. With that, Beeta, do you have any final words? Tim, do you have any final words?
Yeah, my only final words is coming from the advocacy side is I think everyone listening should feel empowered to be engaged and advocating, whether it be on the federal, state, local level. Your voice matters, and we have tools, and we want everyone to use them. So, I I guess my final message is your voice matters, and be an advocate for this cause and others that are important to you to help further the public health and environmental health fields.
Tim, you got final comments for us?
Beta kind of took the words out of my mouth. That was very well said, Beta. But I do want to end on a hopeful note. I mean, I think public health is here to stay, and is going to bounce back in a very strong way. And so I want people to be hopeful, but we are in tough times. So Beta's absolutely right. We got to step up and make our voices heard. Beta often says, if you're not at the table, you're on the menu.
Yeah.
And so we got to make sure we're not on the menu. We got to be directing public health policy going forward and making sure it goes the right way.
Yeah, I think we can emphasize that we got an important profession, but we got to be vigilant, advocating for ourselves and making ourselves be known. We've been, unfortunately, very quiet before Congress and before policymakers, which makes us a lot more vulnerable when we have situations like this. So, Beta, thank you for your work up on Capitol Hill. Tim, thank you for your work out there and highlighting these issues that we need to be aware of. And with that, thank you again for joining us, for joining NEHA Advocacy Insights. And with that, have a great afternoon.
Thank you.